Well, joining us now is Michael Richards, the Executive Director of External Affairs at Gunnarsson Health System. Thank you so much for being with us.
Thanks for having me.
Now, Gunnarsson has been working with people to help them sign up for these different plans. How many people have you worked with that have been dropped by their insurance?
Well, it's really hard to say because they don't really talk about that when they come in. They just say they need to have insurance. Gunnarsson didn't have an individual plan last year, so it wasn't something that people were losing coverage from a Gunnarsson plan. So it's really hard to tell.
It's hard to tell that, okay. It sounds like these folks will no longer be fined. Monday is the deadline, but they're not going to be fined under this new rule change if they're not signed up by Monday. How long do they have to sign up? Has that been determined yet?
Well, the end of March 31st is going to be the time that open enrollment ends, and that's the date that's there today. It could change down the road, but that's what we're sticking to, and that's what we're focusing in on.
And do you know right now, is this deadline extension, is this just for the folks who have been dropped by their insurance, or is this for everyone? Is the Monday deadline no longer in place? Will people not be fined if they're not signed up by Monday?
People will not be fined if they're not signed up by Monday, but the most important piece is they have to buy by Monday in order to be covered by January 1. So that if you want to have coverage January 1st, you have to buy by Monday.
So coverage, yes, Monday.
Right.
Fine will not happen.
But you will not have to pay until January 10th. So you've got some time to pay, you just have to sign up first.
It sounds like there's also going to be a new option, this catastrophic insurance plan. Can you explain what that is?
Well, the catastrophic insurance plan was for people under 30 years of age, but now because people who may have lost their individual coverage will be able to sign up. And that's for, it's going to be a lower premium but higher deductible. It's really if there's a catastrophe. So it's kind of your real backup plan.
And anyone can choose this?
Only those people right now that have lost their coverage. This will count towards the individual mandate of health insurance.
Okay, so those that have been dropped. Now,
Correct.
Gunnarsson Health System, as you mentioned, now they're one of the people who have insurance plans that are available. From that perspective, we saw earlier that there is some worry in the insurance industry that this last change could cause some instability in the marketplace. Has there been any talk about that locally?
Well, the marketplace has caused some instability. I mean, the marketplace website wasn't working, and now the dates are changing. So in general, from the general customer standpoint, it's confusing, and I think that's something that we're going to try to work on, and I think the community is going to try to work on, is trying to help people out.
And that was going to be my next question. A lot of people in the insurance industry, they're saying this is becoming really confusing, and it's a disruption for consumers, and you're seeing that as well locally.
It is, and I think people are wondering, when do I have to buy by, when do I have to pay by, what coverage do I need to have? All those questions, there's help out there. There's certified application counselors at Gunnarsson, and I know in the community at large there's going to be people to help you out.
Is there one important thing that we should tell people right now with this latest change that they should know today?
If you want coverage by January 1st, buy it by December 23rd. And if you have any questions, go to find a certified application counselor or an insurance broker.
All right, thank you for that information.
Thanks
It's
for
very
having me.
helpful. We appreciate it.